This is Sarah Meredith. She lives in Nottingham. She has got children with special needs and other complex conditions. Oh, you switched me off? No, I thought somebody switched me off. Give her a warm hand. Sarah.
Hi, my name's Sarah and I'm speaking to you today as a mum of two boys who have disabilities and health issues, and also as a patient myself. This is my first time ever doing anything like this and I'm pretty terrified. I'm not a doctor and I'm not a politician, I'm just an ordinary mum. A mum who is deeply concerned about my children and others who could be drastically affected by Brexit, and that's why I'm speaking today. My eldest son has autism, dyspraxia, is deaf and has scoliosis. So he has a total of 9 different NHS health professionals involved in his care. My youngest has issues with his immune system and multiple food allergies. He's very prone to infections and has an extremely limited diet. I also have long-term health issues and food allergies like my son. As you can imagine, our family really rely on the NHS and medications. If there were a medication and food supply issues as a result of Brexit, I believe our family and thousands of others could be severely affected. Brexit is already affecting the NHS. I've read that 1 in 10 NHS positions is currently vacant as more NHS staff leave. If the economy shrinks, which I believe it will as a result of Brexit, there is less money for the NHS and other public services. My youngest son is only 4 and has already had 2 life-threatening illnesses. He had sepsis when he was 1 and meningitis when he was 3. He was extremely poorly, and the reality is, if he hadn't had access to the correct medications, he would have died. Sorry. The NHS were incredible, and they not once, but twice saved his life. Knowing the pain and anguish of almost losing a child makes me concerned about what could happen if the NHS wasn't able to function properly in the future. The question that looms in my mind is, will lives be lost through Brexit? My son is not the only member of my family who has had their life saved by the NHS. I myself I'm an asthmatic and I've been needed to be blue lighted to the hospital on a number of occasions. I rely on life-saving medications to keep my asthma under control. There are 5.4 million asthmatics like me in the UK. Consider the impact on them if they couldn't gain access to their medications. Consider the impact on millions of other people who rely on life-saving medication to manage their medical conditions. Myself and my youngest son have multiple food allergies. Ben has a very restricted diet, and much of the food he eats, like free-from bread, pasta and oat milk, comes from the EU. So naturally, I'm very worried about what on earth I'm going to feed him if there are food shortages following Brexit. I'm speaking today not because I want to frighten you, but I think that the full impact of what Brexit could do to the NHS is not really being talked about or understood. Even if you yourselves don't have any health issues, we will all have a family member who does, and this really could affect your nearest and dearest. I'd feel less concerned if the government were acknowledging there was a problem and had set out some concrete plans about what they will do to ensure there are no food and medicine shortages following Brexit, but they are not. I hear people say, why are people's vote? We've already had one and we voted to leave. Now let's get on with it. I understand your frustration, but I ask you to consider, Is this really what you voted for? A country that could end up with food and medicine shortages and an NHS which is not able to cope. There is the potential for lives to be lost through a no-deal Brexit. Are you prepared for Brexit to go ahead, no matter what the cost, even if the cost is people's lives? I'm here today because I cannot stay quiet and sit back and watch our government taking us blindly into a no-deal Brexit without making plans for what could potentially have devastating effects for thousands of families in this country. Thank you so much for listening to me today.
Sarah, fantastic. Can you believe, not just yet, yeah. Can you believe that's the first time she has spoken in public? Absolutely astonishing. Thank you so much, Sarah. Another round of applause for Sarah. Come on.